stand for the invocation and the Pledge of Allegiance, please.
Good morning. Let's invoke the Lord's presence this morning. Almighty and merciful God, in your goodness, keep us, we pray. Come and allow your presence to give us clarity and charity. Keep us from all things that may hurt us, that we may be ready both in mind and body, and may accomplish with free hearts those things which belong to your purpose. We ask you, Lord, who lives and reigns, one God now, to be forever with us. Amen.
I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I'm going to call the meeting to order. Any citizen desiring to address the hospital board should turn in a speaker card to the board secretary. If the citizen comment pertains to an item of the agenda today, the comment will be heard early in this meeting. Otherwise, it will be heard towards the end. Speakers are asked to limit their comments to 3 minutes. Vendors, suppliers, or other persons seeking hospital contracts awarded on a competitive basis are reminded that their ability to address the board may be restricted by the terms of the invitation for bid, request for proposal, or other purchasing criteria. Lastly, the board has established a claims adjustment review panel comprised of representatives of the board, the medical staff, administration, and legal counsel to review and negotiate the settlement of claims. Accordingly, the board will not entertain comments or discuss or negotiate claims at this meeting. Can I get a motion for the approvals of the day? Orders of the day? Sorry. Thank you. Give me a second. All in favor? Any opposed? Great, that passes. And can I get a motion for the approval of the minutes of the meeting on May 14th, 2024? Great. Second. Thank you. All in favor, say aye. Great. Any opposed? Motion passes. We have no board reports today, so at this time I would like to invite David Barrender up to the podium, our CEO, to highlight our Excel winners.
Thank you, Madam Chair. I am happy to report today that we have a number of people to help celebrate with us today. And first I'd like to ask to come join me is Dan Putney. Dan, can you come on down? Congratulations. So Leanne Putney, who is an advanced practice program coordinator for trauma services, is our Excel employee for February 2024. Leanne has been with SMH since 1989 and has devoted her exceptional 36-year career to SMH, our community, and the patients we serve. She has a true gift of communicating with every person she encounters, from her peers to patients and family, and makes a special effort to ensure that off-site staff are included and informed. She also takes every opportunity to represent the hospital in the most positive light. Leanne took a very brave step in 2015 when she asked to be part of the hospital's trauma journey to earn the trauma center designation and establish a brand new service. She did not have a specific trauma care experience, but her expertise and experience in critical care and her passion for education, collaboration, and process improvement were invaluable to the program's inception. She has been an essential member of our team ever since and has played a key role in its many successes. One nomination says everyone should have a colleague, cheerleader, and friend like Leanne. Leanne, thank you on behalf of our hospital.
I would just like to thank everyone so much. I'm so honored. I feel like everyone I work with is more than deserving of this award. And I am beyond honored. I just loved every moment of my 35-year career here at SMH. I've been so proud to have worked with so many wonderful people, so many wonderful board members. I just am so thrilled that I've been able to be a part of the inception of this trauma program and all it's done for the community, and I appreciate all of your support behind that. Thank you all so much.
Thank you.
Okay, next up we have our Excel Award winner for March, and she is Diane Troop Bryant. Diane, come on down. Congratulations. We surprised you last time, this time not so much. Diane has been another Diane is another longtime and valuable employee. She's been a member of our team since 1987 and has been a role model for excellence and wonderful resource throughout her more than 3 decades at SMH. Diane's colleagues say that her knowledge of SMH is second to none, and she's the go-to person whenever anyone has questions or needs information. Her co-workers also say that Diane continually goes above and beyond in her role as a hub. And truly the backbone of the okay. Thank you. Now they do. Can you hear me all right? Okay. All right. She's known for her compassionate communication when she's taking phone calls and responding to call lights, and she always keeps her cool under pressure. Co-workers also say that Diane puts others before herself, picking up extra shifts and lending a helping hand wherever it's needed. Diane, we can't thank you enough for everything that you've done, continue to do. Thank you on behalf of this community, this hospital, and most of all our patients. Congratulations.
I would like to thank you, and most of all, I want to thank my 2 bosses, Maggie Castro and Marianne. I couldn't have done anything without them. They have helped me to be the best that I can be, and I thank them for that. Thank you.
Thank you. And finally, we get to honor our April Excel employee. The winners, Eddie Williams, is a senior technical systems analyst in clinical and business systems. Eddie, can you come up and join me? Stand by me. Make me look good. Eddie has been an employee of SMH since 2021 and works in our Radiation Oncology Center on the University Parkway campus. And here's a couple of comments from the glowing nominations he received. Eddie always demonstrates excellent work in his daily duties to support radiation oncology applications and the devices that deploy the radiation. Along with his coworkers, he manages any issues that arise and helps ensure the team can continue providing vital treatments to our patients. Eddie truly is a dynamic and dependable professional who takes pride in his work and is a great problem solver. As his colleagues say, he comes to work every day with a cheerful outlook, a willing spirit, and a ready smile, and a very strong work ethic. All of these attributes benefit his team members, our physicians, but mostly our patients. As one nomination sums it up, Eddie is just an amazing person. Eddie, congratulations and thank you for everything that you continue to do.
Definitely just want to say thank you very much. It's an honor to be nominated. Tina and Mary, thank you very much for this and for being awarded. So thank you to the hospital and to the awarding group. Just want to say, really love coming to work here. I
I get to work part in support and part with patient facing. And I think it's amazing. We have a great group of people that work at both places, so clinical business systems and radiation oncology. So thank you.
Hey, thank you.
Thank you. Congratulations to all three of you, and thank you so much. We have no medical staff reports today, so at this time, I'll ask Sharon to read the secretary's report, please.
Thank you, Madam Chair. So I'd like to announce the SMH board calendar for June and July 2024. So on Tuesday, June 25th, 2024, from 8:30 to 11:30, strategic planning retreat is planned, which is a closed meeting. From noon to 12:30 is the closed session of the hospital board meeting. And from 12:30 to 1 o'clock is lunch, and from 1 o'clock to 2:30 is the quality committee, which is also a closed meeting. Then on Tuesday, July 23rd, 2024, from 9 o'clock to 10:30 is the joint finance / audit committee. From 10:30 till noon, mission and planning committee. Noon to 12:30, closed session of the hospital board meeting. 12:30 to 2 o'clock is review of finances, board issues, and board lunch. And from 2 o'clock to 4 o'clock is our board meeting. That's all I have, Madam Chair.
Thank you, Sharon. And at this time, our treasurer's report from Bridget.
I move the approval of bad debts and charity care for the month ended March 31st, 2024, in the amount of $21,672,000, and the month ended April 30th, 2024, in the amount of $25,389,000.
Thank you very much. Next up is our financial highlights. Sorry. And all in favor? Any opposed? Motion passes. Thank you. And next on the list is Bobby, to go over our financial report.
Thank you, Madam Chair. Good afternoon. I'm here to present the district's financial highlights through the month ended April of 2024. On slide 2, the month to date for the month of April 2024, a total of $166,170,000 in total revenues, as compared to a budget of $153,088,000 total revenues on budget. For the year to date, which is 7 months ending of our fiscal year, April 2024, we have a total of $1,133,323,000 for actuals, as compared to a budget of $1,061,214,000. Total expenses for the month ended April 2024, actuals of $155,778,000, as compared to a budget of $144,435,000. On a fiscal year-to-date basis, total expenses of $1,065,270,000, as compared to a budget of $1,004,694,000. Operating income for the month of April 2024 totaled actuals of $10,393,000, as compared to a budget of $8,653,000, which represents an operating margin of actuals of 6.3%, as compared to a budget margin of 5.7%. On a fiscal year-to-date basis, actuals for the 7 months ended April 2024, $68,052,000, as compared to a budget of $56,519,000, which represents an operating margin of 6%, as compared to a budget operating margin of 5.3%. On to the statistics page, which is a year-to-date perspective. Our average daily occupancy in total is 904, as compared to a budget of 885. And Sarasota campus had an average acute length of stay of 4.47, and Venice campus with an average acute length of stay of 3.73. Our year-to-date admissions and observation cases total actuals of 47,187 as compared to a budget of 44,296. Surgery cases year-to-date has total actuals of 19,674 as compared to a budget of 18,986. Births for the year total 2,837 as compared to a budget of 2,510. Outpatient registration totals actuals for the 7 months ended April 2024 is 365,117 as compared to a budget of 363,631. Our ECC registrations for the hospitals were 104,824 as compared to a budget of 106,468. Case mix index for the fiscal year 7 months ended 2024, April 2024. The Sarasota campus for all the case mix index was 1.81, and for the Sarasota campus Medicare case mix index was 1.87. For Venice case mix index for all was 1.42, and the Venice Medicare case mix index was a 1.54. This concludes my report, Madam Chair.
Thank you, Bobby. Next up is our committee reports. And this morning we met in human resources as well as quality. So at this time I would like to ask Sharon to read your human resource report.
Thank you, Madam Chair. So the Human Resource Committee met this morning. First, we heard an environmental scan highlighting the human resources challenges and opportunities, including the need for 1,037 new staff for our growing system and the competitive labor market outlook. We discussed the incredible growth that has already taken place, going from 4,920 to 10,138 employees in the past 9 years, matching our volume increases and the projected need to go to almost 15,500 plus employees over the next 2+ years. After discussing our complex workforce dynamics, we discussed our staffing needs as a system. The committee then discussed top priorities for HR industry-wide and our strategies to support them. We were very happy to hear from clinical manager Christine Taylor, who started her career at SMH in 1996 as a patient transporter, and now, with the support of the SMH tuition reimbursement and career ladder, is a bachelor's trained RN with a master's degree in management. We were very happy to hear from her and her challenges and efforts with our help going forward. That concludes my report, Madam Chair.
Thank you so much. After this, we met for about an hour and a half, and Patty Mariah, will you go over our quality committee report, please?
Okay. During our quality committee meeting this morning, the board discussed the inclusion of COVID vaccine information on the SMH website, and the possibility of taking additional action regarding COVID vaccines. In consideration of any action, the board asked our medical staff leadership for their guidance and also took into consideration the publicly available information regarding vaccine safety and effectivity, as well as input of those who spoke at public meetings, sent emails, and had conversations with board members and administrative leaders. The Quality Committee, which is comprised of all 9 board members, unanimously supports the following: that the board will continue to respect and honor every patient's right to make their own healthcare decision within the patient-physician relationship, and using all resources available to them to inform the discussions surrounding those decisions. That the board will continue to endeavor not to invade the physician-patient relationship or mandate treatment regimens for patients to its physicians. That the board will respect that patients, in conjunction with their care providers, should decide which recommendations, treatments, or interventions they use, including what vaccinations are right for them. That the board will continue to advocate for retrospective analysis, research, and evidence-based recommendations from state and federal regulatory agencies with the responsibility for public health initiatives, including vaccines, and encourages patients and their healthcare providers to access all credible resources regarding their discussions and decisions. That the board hereby directs administration to forward comments and concerns of community members related to vaccine safety to the FDA, the CDC, and the Florida Department of Health, and encourage their review of the concerns of our community. Madam Chair.
Thank you. We appreciate that, Patty. We do understand that this is something that's very important to the community, so at this time, we are going to take public comments, and then we will go into discussion after. I do want to read something though, because we're going to do it a little bit differently. We don't know whether the motion as it stands will change your mind about whether or not to speak, but out of respect of the time of everyone here and to ensure that the folks who have the ability to make their information known, we are going to offer the opportunity to have your voice counted as being for or against the motion without having to speak. Of course, if you still feel that you want to speak, we welcome that, but we would encourage those who are in agreement or in opposition, but believe that the other speakers will adequately explain their feelings to do so. They do this in Tallahassee at committee meetings and waive in support or opposition, and it does work. So you've heard the motion, and when I call your name, if you do not feel that you need to speak yourself, you can just say, I waive in support or waive in opposition, and we will count that. Start. Dr. Washington Hill?
Madam Chair,
Yes.
I think in the interest of the crowd, they just now heard the motion that has been made and put forward by the Quality Committee. I really think it would be helpful if we read the motion one more time. I would recommend that someone, no offense on your reading, but a strong voice
Yes.
will read the motion.
We will have Carolyn read it right now again for everybody. Sorry, Dr. Hill, 1 second.
I agree, I wasn't quite clear what the motion
Okay.
was.
Great.
So the motion as it stands would take the following actions on behalf of the board. I think what you're gonna say, Brad, is that this is a recommendation from the Quality Committee, which is comprised of all 9 board members, and that this motion to recommend this to the board passed unanimously. Is that what you were gonna say? I thought so. Okay. These are the components of the motion that came as a recommendation to the board from the Quality Committee. That the board will continue to respect and honor every patient's right to make their own healthcare decisions within the patient-physician relationship, and using all resources available to them to inform discussions surrounding those decisions. Number 2, that the board will continue to endeavor not to invade the physician-patient relationship or mandate treatment regimens for patients to its physicians. The third component, that the board will respect that patients, in conjunction with their care provider, should decide which recommended treatments or interventions they use, including what vaccinations are right for them. The fourth component, that the board will continue to advocate for retrospective analysis, research, and evidence-based recommendations from state and federal regulatory agencies with the responsibility for public health initiatives, including vaccines, and encourages patients and their healthcare providers to access all credible resources regarding their discussions and decisions. And finally, that the board directs the administration to forward all comments and concerns of community members related to vaccine safety to the FDA, the CDC, and Florida's Department of Health, and will encourage their review of the concerns of our community.
With that said, so Dr. Hill, what we're asking now is we will ask I'm gonna read everybody's name, you do not need to come up, we welcome you at the podium, but we will just ask for you to wave your hand in support or opposition, so you can stand and say, I support or I oppose. And then if you do want to continue, if you still want to speak after that, we will call your name again to come up. So,
I speak in favor of the motion.
thank you. John Abel and Abu, sorry, Abu. Thank you. Yusuf Ade,
No, thank you, sir.
okay. Sally Nista.
I abstain.
Can you repeat that?
I abstain.
Okay, abstain. Thomas Caffrey.
I abstain.
Edner Lawrence.
I support.
Beatrice Spadola.
I oppose.
Susan Cohen.
I support and I have something to say.
Susan, okay, that's fine, come ahead.
We want to say, we want to speak. We want to
Okay, so
speak. You said you were going to read them through, then you were going to get a chance to speak.
I did.
I'm
We will
sorry.
come back, it was just a misunderstanding.
Sorry, the intention was that you either waived in support or opposition or came forward to speak.
I want to speak.
Okay, we can come right back to you right after Susan.
Thank you.
Thank you. Good afternoon. My name is Susan Cohen, and I've been a Sarasota resident for the last 9 years. It takes a lot to get me up here to address this board, because I view both deaf and public speaking with the same amount of enthusiasm. But this has become very personal for me. I'm a retired registered nurse with 45 years of clinical experience throughout the healthcare continuum. And I have strong views about the obligation of healthcare professionals to protect the most vulnerable, who are our patients. And in every nursing job I've held, I've been required to do that by providing proof of vaccinations so my patients don't assume undue risks from any care I provide to them. And I did so willingly. I'm old enough to have worked through a resurgence of drug-resistant TB, the AIDS epidemic, SARS, avian influenza, and a possible anthrax attack. So you can see I have a lot of years on my side. In each and every instance, I had a choice to follow the requirements of my healthcare employer or to find employment elsewhere. In every instance, I followed the scientific advice of the majority of healthcare professionals practicing evidence-based medicine, because I took my obligations as a nurse seriously, and my patients came first. And then my script flipped, and in January of this year, my husband became a patient in SMH and depended on the doctors, nurses, and other ancillary workers who took their obligations seriously. Critically ill with sepsis following his first chemo cycle and immunocompromised, any unvaccinated employee who entered his room carrying the COVID virus would have ended his life. And because any communicable disease can spread quietly and quickly with no warning, that would have held true for the unvaccinated cafeteria worker, the person who provided transport, or even the billing department employee who interacted with anyone in the chain of people who led to my husband. But because SMH followed the science and took its obligations to the community it served with the utmost seriousness, my husband is here today in good health, and I am up here thanking you for your professionalism and dedication, and urging you to continue to uphold these values. I thank you for giving me the time and your attention.
Dr. Hill, if you would like to speak, we welcome that. And then we'll go through the whole list. So if we are recalling the names and starting over. Dr. Hill?
Thank you. Good afternoon. I'm Washington Hill, and I've lived in Sarasota since Sarasota Memorial Hospital asked me to come and start the high-risk pregnancy program, which was 35 years ago. I am a member of the Doctors Medical Society, a local affiliation of the National Medical Association. We strongly believe our job is to take care of, educate, and advocate for vulnerable patients in our community, especially those of color. The facts are from COVID cases at this hospital and nationally that the administration of mRNA COVID-19 vaccine to pregnant women in the past and now is beneficial to them and their newborn. Use during pregnancy has saved the lives of pregnant women, their babies, and is safe. Florida Surgeon General's claims about this COVID vaccine are false. They do not impact an individual's DNA. Saying they do is false. The facts are the FDA, CDC, NMA, and other organizations have made it clear and answered those concerns, warning that this type of misinformation and disinformation will result in fewer people, including those who are pregnant, getting vaccinated, contributing to the death and serious illness of either mother or baby or both. CDC says without equivocation, mRNA vaccines cannot change your DNA in any way. I urge this entire body to listen to the words of the Sarasota Memorial Medical Executive Committee and the medical staff experts. Vote no on adopting anti-vaccine guidance. Understand, not interfering with my doctor-patient relationship is real medical freedom. SMH putting on its website misinformation spread by the Florida Surgeon General, his colleagues and leaders spreads rumors and false information that can be dangerous to all patients who listen to us, doctors and nurses, with truth. It is an unneeded intervention and a threat to the doctor-patient relationship, in truth, misleading people's perception. The physicians of this hospital and the nurses of this hospital and the staff of this hospital are dedicated to helping patients and families find accurate, evidence-based information as they make healthcare decisions that impact their being. Please vote no, and thank you very much.
Next up, Dr. Hill.
Thank you, Madam Chair. I support everything Dr. Hill just said. I think I have much more to add, but the things I'm going to add here are very simple. Let us talk about trust. I just want to focus on the word trust. I have been in this community for the last since 1999. I remember the medical staff here at SMH for the last 21 years. And I have worked in so many other states. I find that the culture of safety, culture of respect, both the patients as well as the staff, is very paramount in this institution. As a result, I decided to make this my home. So what I say is very personal to me and to my colleagues. Now, physician-patient relationship is sacred. I should always remain sacred. The manifestation of this sacred relationship is unalienable trust. Trust to do no harm. That is our motto. And that is what we should also follow, based on the sciences. Trust never to betray or harm my patients. trust to provide my patients with the best available medical advice. Trust to always provide my patients with a sound scientific and evidence-based advice. This is the fundamental to the health of our patients and to the health of our society at large. To ask any of us to do otherwise, to deviate from scientifically proven treatment is a pill that is difficult for me to swallow, and a pill actually impossible for anyone who provides care to patients to swallow, and we will not do that. These board members, you are tasked to be relevant. Don't make yourself irrelevant by making decisions based on non-scientific evidence. If anyone knows my background, I know about past science. So we are not going to go there. In that sense, that's more I really want to say, but the only one message I want to leverage, the practice of medicine should be and will always be guided by scientific evidence and not politics or ideology. Thank you.
Next up is Edgar Lawrence, and you can either wave in support or opposition if you would like to speak.
Support.
Thank you. Next up is Beatrice Stodola. And you can wave in opposition, support, or speak.
I agree with Dr. Hill and Dr. Abreu, and I waive my chances.
Thank you. And next up is Sally Niska.
Hello, Board. As a grassroots conservative, I want to calm some fears and dispel the misinformation. Conservatives love having a public hospital. We value that we can come and share our concerns and celebrate when our medical community does something well. It is especially important now as the medical industrial complex is crumbling and everyone is learning how we were lied and misled. Conservatives know that the hospital community will need to look to us for better direction, critical thinking, and resources. If Sarasota Memorial was a private hospital system, all of these horrible protocols would be swept under the rug without examination. We are so grateful SMH is a public hospital, and we can and will be participating to make sure that you are doing all of the right things. I would like for this board to explain exactly why it is so difficult to put the Surgeon General adipose recommendations on your website. I understand that he has a different opinion based on his expertise and the research that he has accumulated. I appreciate that he is giving Floridians a different perspective. Considering the data now coming out about how dangerous, flawed, and ineffective the experimental vaccines are to people, I am grateful for his differing viewpoint. Ultimately, isn't this hospital supposed to be about informing, educating, and allowing the patient and their doctor to make decisions about treatment, not just what the government tells us to do? Why then is it so difficult to share Dr. Ladipo's recommendation? It's telling. It tells me that you're not as transparent as you say you are. That's a problem. a problem that we hope to fix on August 20th. Thank you.
Next up is Thomas Caffrey.
Wish to speak?
Okay. Yes, I'm sorry. If you are speaking, can you give your name and where you are from? I'll do that.
Madam Chair, my name is Thomas Caffrey. I'm from Sarasota. During my 30-plus years working in the pharmaceutical industry, I have read, dissected, and analyzed data from thousands of clinical papers, so I feel that I am qualified to present a well-informed, rational opinion. There's an old saying, the need of the many outweigh the want of the few. When the COVID-19 vaccines were approved, I was quite hesitant to take them. However, after review of the data and the science, I took the vaccine twice. I did so because I was convinced that these vaccines were safe and effective for the majority of the population. As everybody knows, no drug or medicine, even aspirin, is 100% effective or 100% safe for every person. There are always subsets of patients who cannot nor should not take a particular drug or medicine, whether it's an antibiotic, a vaccine, pain med, or diabetes medicine. Any medical advice or recommendation sponsored by any individual not possessing a medical background that is not part of a FDA, CDC approved input or part of any established best practice guidelines should not be added to the official SMH website. Science, clinical data, and facts should drive the decision for treating the majority of the people. Good medicine utilizes best practices. This recommendation is needed. To any individual looking for medical freedom, know this. You already have medical freedom. No matter what any acceptable guidelines say, for any aspect of medicine or safety issue, you can already freely choose to accept it or not. If you don't want to take a vaccine, you are free to do so. If you don't want to wear a helmet while riding a motorcycle, you are free to do so. If you wish to take an unproven or non-approved treatment, you are free to do so. If you want to gargle with bleach or inject it into your body, you are free to do so. To the board of directors, please do not vote for this recommendation. Your responsibility is to keep the vast majority of the population safe. An ill-informed opinion by a small group to appear not to know the data, do not understand the data, or who are unwilling to accept the data should not be the basis for deciding what's good for the majority of people. Thank you.
I'll give a qualified yes, but I do like to speak.
Okay, so you're in support, but also a Mrs. Vicki Knightswinder. And
I think a point of order is necessary here is I'm not sure if the audience understands that Vic Rohe's motion that he proposed back in January is not under consideration. In the quality committee meeting, a motion came from there which is very much different that Carolyn Kalish read. And perhaps we should read it again to make sure you understand what we are going to be voting on at the conclusion of the public comments, because I don't want to mislead anybody. The Vic Rohe motion is not up for consideration. It was changed in the quality committee, and I would suggest we read it again so that people understand.
And to your question of why, he amended it, and then we unanimously voted on what has been read twice, which is the motion on the table.
And I'm happy to read it again if that's helpful. and Ms. Nicewinder, this is not counting into your time, I'm sorry that you're standing. So again, the quality committee, which is comprised of all 9 board members, unanimously supports the following as a recommendation to the board. That the board will continue to respect and honor every patient's right to make their own healthcare decisions within the patient-physician relationship, and using all resources available to them to inform the discussions surrounding those decisions. That the board will continue to endeavor not to invade the physician-patient relationship or mandate treatment regimens for patients to its physicians. That the board will respect that patients, in conjunction with their care providers, should decide which recommended treatments or interventions they use, including what vaccinations are right for them. That the board will continue to advocate for retrospective analysis, research, and evidence-based recommendations from state and federal regulatory agencies with the responsibility for public health initiatives, including vaccines, and encourage patients and their healthcare providers to access all credible resources regarding their discussions and decisions. And finally, that the board hereby directs administration to forward the comments and concerns of community members related to vaccine safety to the FDA, the CDC, and Florida's Department of Health, and encourage their review of the concerns of our community.
Thank you, Carolyn. And so when we state that you're supporting or opposing, or when you are stating that, you were either in support of that motion or opposing that motion, just to be clear. Yes.
Madam Chair, I just want to bring something to UA's attention.
That's fine.
At the committee meeting this morning, we had a very extensive and heated discussion. And based upon that discussion is what produced what we have now.
Okay, with that said, and if you could state.
I'm sorry. Just further to amplify Mr. Rowe's point, and because we've read the actual motion so many times, I feel a little bit compelled to read Mrs. Marai's introductory remarks to remind the audience and again, Mr. Rowe, to amplify your remarks. The board discussed the inclusion of vaccine information on the website and the possibility of taking additional action regarding COVID vaccines. In consideration of any of those, the board asked medical staff leadership for their guidance and took into consideration the publicly available information regarding vaccine safety and efficacy, as well as the input of those who spoke at public meetings, sent emails, and had conversations with board members and administrative leaders about this. So that was the background.
Yes, I think I mentioned that, and we discussed it for an hour and a half, so it was not taken lightly. There was very heavy and thorough discussion about why and where we got to where we are. So, with that said, Vicki, we would like to hear from you.
Thank you.
Please state your name and where you're from.
Sure. I'm Vicki Nicewinder, and I've been a resident for close to 20 years. My background is public health, and I've had to revamp what I was going to talk about because of what you've said and what you've agreed to, which I am the majority supportive of. I would like 2 points to be made. The first point being, I think it would be really, really helpful for the public to understand your process when these kinds of resolutions come up, what process is taken, have some transparency in it, have some openness and not do it overnight kind of thing. This kind of resolution policy is something that's going on throughout the community, not just here in this setting. And we need to be prepared for that and know that the public will be questioning the process that is taking place. The second point is because I'm a retired public health practitioner and I've dealt with a lot of communicable disease issues, I'm very concerned about the handling of hazardous communicable diseases. And I'm not sure that your steps have fully addressed the significance of that. And I hope you will expound on that in the future. Thank you.
Thank you. Sorry about that. Next up is Marilyn Kirkwood. You can either support, oppose, or let us know if you would like to speak.
I would like to see.
Okay.
My name is Mary Ellen Kirkwood, and I live in Sarasota City. I'm really very happy that the board did not recklessly try to practice unlicensed medicine. And I also want to say, I happen to be a common sense, grassroots conservative. And I do believe in science, and I do believe in transparency. And I'm very happy. You know, there's 96 licensed vaccines in the United States. I would hate for us to go down the path of picking and choosing like there's a buffet in the practice of medicine. Medicine is left to the physicians to practice. And I really object to outside influences trying to interfere with the freedom of every patient to work directly with their physician and make their own decisions. After all, we are supposed to be free Florida. And I also noticed in the Sarasota Herald Tribune article, we don't know where this resolution came from. I would very much like to know who crafted, who created, who presented this resolution to our hospital board. That's all that I have to say. Thank you very much.
Next up is Delcy Cushmore, and you can either wave in support, opposition, or speak.
No.
Okay, so opposition. Thank you. Next is Janelle Heineman. Janelle, would you like to speak?
I'm in support and I want to speak.
Okay, thank you. And following Janelle is Allison Elor, so just be prepared.
Thank you. Again, my name is Janet Lee Heineman, and I'm from Siesta Key, Florida. We have a close friend and relative who died of COVID before the vaccine became available. And I know many lives that were saved thanks to the COVID vaccine. I'm sure you remember how challenging it was for SMH during the height of the epidemic. My own husband had to have emergency cardiac surgery, a triple bypass, during that time. And that night, instead of being put in the cardiac ICU, that unit was filled with COVID patients. So the cardiac patients were put in a room that looked to him like a warehouse. We certainly don't want to go back to those days. Vaccines save lives. Our major goal with Rotary around the world is to vaccinate all children from polio. At this point, we have almost made the world polio free. Our own son, who had HPV throat cancer, died in 2020. He never smoked or drank alcohol and was extremely fit. If the HPV vaccine had been available when he was younger, we would have never lost him. I could go on and on, but I think you all know the vaccines save lives. Please do not put us back in the dark ages because of misinformation. I worked with the NIH on some clinical trials, and I know how scrupulous they are in approving clinical trials, sometimes frustratingly so when you're dealing with life-threatening situations. We have an excellent hospital with a great reputation. Myself, my family, and many friends have had several inpatient stays at SMH in the 30 years we've lived on Siesta Key. I can't imagine the damage being done if you had allowed a board member to influence decisions that would impact all of the wonderful professionals working at Sarasota Memorial Hospital. I am pleased you did not agree with the anti-vax resolution. Thank you.
Next up is Allison
West Florida. So I am happy to hear a couple of things, and most of it is around the solidification and of your medical stance to do no harm, to provide informed consent, to be able to provide the public a safe place to come to a hospital for independent medical care. However, I don't think that the resolution goes far enough because it doesn't acknowledge the real dangers that we are seeing within our community. It is documented and evidenced that these vaccines didn't do what they were supposed to do. You were told when you got injected in your arm that you weren't going to get sick, that it was going to stop the virus in its tracks, that the lipid nanoparticles in the spike protein would not go throughout your body. Yet now we see teenagers with myocarditis, with pericarditis, that are forever harmed. We see strokes, we see blood clots that our professionals here in this hospital see. Are those being reported? Are those being communicated to our community? I doubt it. We are seeing miscarriages, we are seeing turbo cancers. All of a sudden, very healthy people have stage 4 cancer and they have no explanation. Are we asking the questions, did you get the COVID-19 vaccine? You cannot have causation if you're not even asking the question when you're getting care. Surgeon General Latico made the recommendation that these things are not safe. That at least our community should be aware that our Florida Surgeon General has very articulately and methodically documented the severe risks that they're having, not only in our community, but worldwide. So what happens to the mRNA COVID-19 injected injured? Are they going to be continued to be gaslighted, told them that their problems are just in their mind? I don't know about you, but I've met so many people that have had turbo cancers, autoimmune deficiency issues, right after their boosters. This doesn't go far enough. And I ask you guys to reconsider. Thank you.
Thank you. Next up is Lisa Roulette, and you can either speak. Never mind, we do.
So do I understand correctly that all 9 of you, if I write to you with my concerns about
Lisa,
COVID?
Can you announce your name and where you're from?
Oh, I'm Lisa Roulette from Nokomis. So do all 9 board members, if I write to you and I'm concerned about the vaccine, are all of you going to direct my email to the CDC and FDA? Is that what you've decided? Because you're putting me back in the arms of my abuser, okay? MIT, the research director of the MIT Human Genome Project found DNA contamination in these. The inventor of the mRNA vaccine platform found DNA contamination in these. Our state surgeon general said that these are cell entry enabled. They can go in our cells. We have asked the FDA, do the test you said we should do. Is this corrupting our genes? He is not saying that he's testing. This is scary. We could be having cancer. Do any of you, show of hands, who is confident that there is no DNA contamination in these vaccines? Who is confident of all 9 of you? These are being injected into babies. And you're putting us back in the hands of our abuser? This is crazy. Where can we go for help? MIT director of the Human Genome Project said that these can go Who here will say you will meet with me? Anybody else? Who will meet with me? I have facts on my side. I have facts. MIT director of the Genome Project, the inventor of this vaccine platform. Who will meet with me and let me present the facts? None of you? One of you? 8 of you. I have legitimate concerns. Facts on my side. And only one person will meet with me. Who will tell me I'm wrong? Who will tell me I'm wrong? Who says there is no DNA contamination in these vaccines? Raise your hand if you can tell me there is no DNA contamination in these vaccines.
Turn around.
I don't know if you've done your research yet. Okay, so nobody will confirm. I don't know what to tell you. I am so disappointed.
Lisa, you're out of time. Thank you. Next up is Robin Williams. Would you like to wave your hand in?
I'm Robin Williams. I'm a retired biology teacher. I'm glad you did not use Latigo stuff in your resolution. However, it seems like you're trying to appease the anti-vaxxers, and I'm very concerned because public health is critically relies upon vaccination of highly infectious diseases. Sarasota County has the worst record of childhood immunization in the state, and literally 10% of kindergartners are not vaccinated. Dr. Latipo gave very, very dangerous information out to parents saying that expose kids who are not vaccinated to go to school. That is really putting public health of all our children and their safety at risk. Let me just say that measles vaccination averted 56 million deaths between 2000 and 2021. Before the 63 measles vaccine, major epidemics caused 2.6 million deaths every year. It's incomprehensible that Florida's Surgeon General would make such dangerous recommendations. I just want to clarify to you some of the misinformation that Dr. Latipo gave about SB 40. The European Medicine Agency, which regulates vaccines in EU countries, explained that altered non-functional fragments of SV40's DNA sequence were used as starting material to produce the vaccine. Those materials are broken down and removed in the manufacturing process. Any trace amounts were at very low levels, but again, it's altered. It's not what they think it is, or he presents it as, but they're well within established safety guidelines. They're also not aware of any scientific evidence showing that small amounts of residual DNA can integrate into the DNA of vaccinated individuals. The FDA agrees, saying no safety concerns about residual DNA in COVID vaccines has been identified despite more than 13.5 billion doses administered globally of the COVID vaccines, and in the US, 677 million. There was SV40 contamination wild type back in the years of early polio vaccines between 55 and 1961, and that was long before genetic engineering, which altered it. Some of those were from kidney cells from monkeys that were infected, but many years later, they've not found any substantial increase in SV40 neoplasias. The COVID vaccine is an mRNA vaccine. mRNA can't enter the nucleus. Since mRNA isn't DNA, it would need to be translated or reverse transcribed back to DNA. And the vaccine doesn't have such a sequence, since RNA can't be integrated into DNA. It's not possible for messenger RNA to change DNA.
Robin, we're out of time.
Oh, sorry.
That's okay. Thank you.
I have more.
That's Stephen DeFonte, would you like to wave your hand in opposition, support, or speak?
I'm Dr. Stephen DeFonte.
a resident of Sarasota. There seems to be a debate as to whether you should post the Surgeon General's position on the SMH website or say nothing. I suppose this is more of a public relations dilemma than a public interest issue. Because you had promoted the vaccine on your website previously. Well, welcome to medicine. Yes, in the long history of medicine, mistakes have been made. We have progressed as far as we have only by admitting those mistakes and learning from them. This is why we no longer use leeches. I would like to propose a compromise. There's a group here asking you to stand for science. That seems reasonable. Why not post both the Surgeon General's position and the science? This would give the public informed consent. No one knows the science better than the manufacturer. The manufacturer reveals the science in its package insert, which I brought here today. As you can see, there is nothing in the package insert. This is the science that we're trying to defend. And you might wonder why the manufacturer, if with over 230 million Americans having taken this vaccine, seems to find no science behind it that the manufacturer will admit to. I would recommend you post both for 3 reasons. First, you're a teaching hospital. The message you send to your residents and your researchers can either be, we learn from our mistakes, or we cover them up. Science dies in the cover-up. Second, since my experience here, your staff has always taken the cover-up position. If the board chooses the public interest over the public relations interest, the people of Sarasota County will trust this hospital more. And third, for the public to make an informed consent, they deserve at least 2 opinions. So far, you've offered either one or none. That comes across more like a mandate than informed consent. Doctors give advice, not mandates. You have a choice, cover up or public interest. Please do the right thing. And vote for Vic Rowe's original motion. Thank you.
Next up is Clement Because. I'm sorry, maybe you have that last name.
I support what you're doing for freedom of choice with your physician.
Thank you, Kenny. Next up, Mark Cohen.
I'll say that I support your stance and agree that a lot of work still do.
Thank you. He said he supports. Next up is Sherry Thornton.
Good afternoon. My name is Sherry Thornton, and I live in Venice, Florida. And first of all, I would like to thank the Quality Committee and all of those professionals and experts that got together and came up with this proposal, and I'm in support of it. Secondly, I really would like to thank Sarasota Memorial Healthcare System for being the true leader that you are. It shows why you have a grade A from Leapfrog, why you're nationally recognized, that you took this on with your quality committee and came up with the resolution that you came up with. So I'd like to commend your leadership and your board for doing that. Thank you very much, and I appreciate having this organization as a resource in our community.
Next up is Brenda Pastoric.
But really recommend Dr. Latipo's
Thank you. And next up, Connie Bruni.
I'm Connie Bruni. I'm a Sarasota taxpayer and a lifelong conservative grassroots activist, in case you didn't know. I've been here about 10 years, and I sent you all an email regarding this issue. I hope that you all received it, along with lots of others, I'm sure. It is long past time for this elected board to go on record with regard to Dr. Latipo's recommendations. It's time for transparency. So I want to ensure that we get the feds, get the WHO, get the CDC, and get the FDA the heck out of my life and my healthcare. I object vociferously to the concept that because I sent you an email, it's going to be forwarded to the CDC and the FDA. What, so FEMA can come and cart me off? I'm not okay with that. It comes across to me as a taxpayer as a threat, not in any way as something that should, and I see people shaking their heads, and I'm telling you how I feel. I am entitled to that feeling of feeling threatened and not agreeing with this. I was hopeful when I listened to the beginning of what you were doing. And then it came to the poison pill, which was, oh, by the way, if you send us anything, if you talk about this, we're going to tell on you. We're going to make sure other people know what you think. Go right ahead. In my case, I don't care. But I think it goes against what we want in our community. We want these external influences, as a previous speaker said, out, O-U-T, of that relationship between us and our doctor. That's freedom. The other thing I wanted to say to you was this. This lovely presentation came in my mail over the weekend, SMH Today, from the foundation, which I found very nice. However, I do want to suggest to the foundation and to the hospital that perhaps you suggest to the foundation that when they publish this entity, very, very nice, that they refrain from using candidates who are actively campaigning, as there are lots of you who are not, who could be featured in these, lest it be seen as an in-kind contribution to those campaigns. I do want to tell you, do no harm. When I faced my own challenge in October, I sought care outside this county consciously because I don't trust you. I want to trust you. I need to trust you. And I intend to change that on August 20th.
Clayton Taylor, would you like?
Hello, Clayton Taylor, resident of Nokomis, Florida. I'm here on my behalf and not on behalf of any public boards that I serve on. I wanted to share with you, first I stand in support of Vic Rowe's original motion. I think it's important that our public be informed of the vaccines, what it's good at and what it's not good at. I want to share with you the experience of one of my friends who took the vaccine. He ended up with an automatic defibrillator for a year. It took him a year to get his health back. One of my other neighbors ended up with myocarditis. It was not good. I took the vaccine, and guess what? I got COVID. So I survived it. I think I would have survived it without the vaccine. So as far as the motion before the board, there are certain elements of the motion I could be supportive of, like doctor-patient relationship, agreement on care methodologies, rights for all prescription use, even off-label use if it's necessary. We are not the patient of the government. We are not the patient of a pharmaceutical. We are not the patient of a medical corporation. We are the patient with our doctor. So I support Vic Rowe's original motion. I hope that you put both sides of the information on your website so that we can all be informed. And thank you for all the lives you saved and all the good things you do in the hospital. Appreciate it.
wanted to speak on COVID. If you did not indicate that you wanted to speak on that, you can come forward now. Those were all of the people who indicated that on their form.
I made out a card.
It doesn't indicate this on
This motion.
this motion, so what are your names?
Ruth Brandwein.
Saul Bilstein.
Anyone else made out can be.
So this, it was asked if you wanted to be on this part of the agenda. We can adjust it, but otherwise you would be at the, later on the.
Saul Bilstein, who else? Michelle Posey?
John Cobell.
Okay, also not indicated. Who was the other
Robert
one?
Oliver, and it's indicated.
Robert Oliver?
It's not.
You are signed up, but this item wasn't indicated, but you're welcome to come forward. Anyone else?
Do you want us to just come up?
We will start with, Michelle will start with you.
I'm sorry, were there, these are the names that I have.
Oh, Esther too, Esther?
I'm sorry, is someone saying Esther?
Esther.
Yes. We don't have a yellow
We do not
form.
have a yellow form.
Okay.
Yes, thank you.
Thank you. Michelle Posey, Sarasota County. So just so I'm absolutely clear, there was a motion made, and it wasn't just yesterday, it was quite some time ago, to include Joseph Latipo, our Florida Surgeon General, highest ranking medical person in the state of Florida, to put his words on a publicly funded hospital's website. A publicly funded hospital's website that was changed like clockwork every time the CDC blew in the wrong direction. You had no problem updating your website, but we're changing that motion, and everyone is agreeing now to this watered-down version of a motion. Things like not mandating treatment, respecting body autonomy, decisions being between a physician and a patient. Can I ask you, what were you doing before this? What were you doing before that? You have to make a resolution for that. I think you're proving my point. That was not the heavy burden that we tasked upon you. We asked you to put Joseph Latipo's words as the Florida Surgeon General on the website. I get told when I come into this room by some people who get called anti-vaxxers, we're humans. I've had every vaccine that was required of me as I attended public school. We're not anti-vaxxers. Don't gaslight the fact that we have a brain and the ability to ask questions. I think we need to be really, really careful about that. There was a motion made to simply align our public hospital website with the words of our highest ranking medical opinion in the state, a public official, Surgeon General Joseph Latipo. Latipo spoke in great detail about the efficacy, safety, and risks of the mRNA injections that have been propagated from many in this room, and the interest of science, you like science, right? Following the experts, hey, I hear he's an expert, and staying true to the ever-changing confines of medicine. I would like to know why we are not, as a publicly funded hospital, echoing the words of our state's top medical official. You mentioned things like the FDA. The FDA just had to do a bit about face with regard to ivermectin. Why? Because people went after their pocketbooks and tried to sue them. So they've changed their tune on that. You talk about credible sources. Is Joseph Latipo not a credible source?
No.
Do you hear that? He's a physician, Surgeon General, from Ivy League. Do you see that? They don't want science. They want a flippin' echo chamber, and I'm done with it. Public hospital, time you respect the public.
Thank you. Next up is Dr. Robert Oliver. Dr. Oliver, can you wait 1 second and let Esther
Sarasota.
Hi. I'm not gonna scream it out.
Get here.
Can you stand there? And name and where you're from, please.
Oh, can you hear me?
Into the mic.
Can you hear me now? Yes. Oh, good. My name is Dr. Robert Oliver, professor of public administration. For many years, I've studied organizations. I think the largest was 10,000 employees, recommending how they improve and how they become more efficient and more effective. I'm a resident of Sarasota, and I've been here for 5 years and love this place. I came here today because I want to be able to say something about Sarasota and Sarasota Memorial Hospital. A year and a half ago, my wife almost died. But she didn't. Because the doctor at Sarasota Memorial Hospital, the one that passed away, was so proficient and so excellent that he saved her life overnight. And then 6 months ago, I was diagnosed with a serious heart condition. And I'm here. I called a friend of mine who was the second in charge at Hopkins in Baltimore and said, Brian, I'm in Sarasota. I don't know the hospital very well. And I don't know the doctor. Could you give me some advice on where I should go in this country and what I should do? And he said, what hospital are you at? I said, it's Sarasota Memorial. Who's the doctor? Dr. Sell. He's the heart doctor. He called me back about 3 days later and said, I researched the whole country. He said, the hospital you need to be in is Sarasota Memorial Hospital. And the doctor you need, who is the best in the state, is Dr. Sell. And I'm thinking, well, that's a good coincidence, because that's exactly what I've done. And as looking at this hospital, I want to commend you folks for running one of the most efficient organizations that I've seen. And I've seen it from the patient side. I've seen it more there than from the administrative side. On the patient side, I couldn't imagine a better circumstance, a better outcome, more professional people than occurred in my instance, and that in terms of my wife. So I very much support Sarasota Memorial Hospital, what you're doing, and how you're doing it. I know you're big, I know you're complex, and I absolutely support the work that you did during COVID in making sure that people were cared for properly with the right medications and not those that are untested.
Thank you, Dr. Oliver. Next up is Esther Ratchwell.
Hi, my name is Esther Rockwell, and I have been living here for, next month will be 39 years. I have been in Sarasota Memorial several times. As a citizen and a taxpayer, excuse me, I fully support Vic Romey's motion to include Florida Surgeon General LaPome's serious warning to be included in the SMH website. According to the well-documented dangers and contamination of the RNI COVID-19 vaccines, I strongly urge each of you to approve this notice. Bear in mind that many people are against this motion, but they have to ignore all of the aspects that are going on. Many people today are dying of cancer today that never had cancer. And it has been reported that people who had a cancer that was, in the past, has it now returned. Many of them do. You can't ignore what is happening today. There are too many people dying of cancer. And what about the people that died of myocarditis they were young, they were very active, they were in sports. And after they took the COVID-19 shots, they suddenly died of myocarditis. There were 5 airport pilots that died after they took it. Now those are red flags, you can't ignore that. That's not something that you're going back from science. Years ago we took vaccines, and they were good, we all took them. But this COVID-19 was in its infancy and was not fully tested. It's now that we're seeing the results of this test. And you can't ignore that. You can say, well, yes, I know, I've been living here so long. Sarasota Memorial always had an excellent reputation. But I have heard from too many people now that have not seen that excellent reputation that they used to have. So please, take into consideration, look at the results. I was in the hospital a year ago, a little over a year ago. And when you go in the hospital today, the doctor that treats you at the hospital is your doctor while you're there. And when he saw me, after I was there a day or two, he said, you have cancer of the pancreas and you don't have long to live. I tried to say, well, I always thought I'd live to be 95. He said, you'll never make it. I am 95 now and I have survived. Because when I went to see my doctor, my son was with me, one of my sons was with me, and he said, I want to see the report from the hospital. When he looked at the report said there is no cancer in the back.
Thank you, Esther. Time is up. Thank you. Next up is Sal Kilsey.
I'm Saul Kilstein. I'm a full-time resident of South County with over 4 decades of health policy and administration experience to share, and I promise I'm not going to yell at you. I will say, however, I am disappointed with the action the board has taken and the short notice we've been given to consider it. And with all due respect to the board, I think you've taken a pass on a very hard issue, and I would encourage you to put it on the table. When you consider the implications of many of the sections of the proposal you're asking us to consider, there are implications of it that I think will have profound implications for not just the COVID issue and the public information issue, but for the operation of the full system that you're responsible for. Many of the issues, not just the doctor-patient relationship, but the operation of your many facilities, the hospitals, the research facility, your new cancer center, the research facility you're bringing online, the heart center, your recruitment of medical professionals, the research you do in collaboration with pharmaceutical, medical device, biomedical research, and your teaching programs could profoundly be impacted by the provisions you've included in this resolution, including the potential to not require patients, visitors, and others to be vaccinated, to have the documentation that could be required during medical emergencies and the like. So again, this institution needs to be science-based. This institution needs to follow the requirements of government regulations. Some of these provisions could jeopardize Medicare, Medicaid regulations, not currently in place, but potentially in the future. You need to put this on the table, have conversations with government officials operating the certification process, the inspection process, and consider these very carefully before going forward. This is a science-based institution, not a communications institution. You need to not be guided by the cries of the medical freedom noise in the system right now, but operating a mega facility that's trying to grow and serve the needs of the community. And that's my message to you. Thank you for the opportunity to address you.
Next up is Ruth Brandywine.
Brandywine.
Good afternoon. I know everyone is tired. My name is Ruth Brandywine, and I've been a resident full-time of Sarasota for almost 15 years. I came here this afternoon fully prepared to be against Mr. Rowe's resolution. And then I found out that it wasn't being offered, and there was another resolution that was being that had been completely approved unanimously by the board. I have a great deal of respect for this board and all the work that you do and have done, and the work of the institution. And so I was thinking yes, but I'm confused because I am a retired professor of social policy and I like to analyze things. I had read very carefully Mr. Rowe's resolution. I haven't had a chance to read the new resolution. So I think I'm in favor of it because I respect all of your positions, but it would be nice if we had had it up on the board or if we had some prior information about it. But I respect the fact that you spent a lot of time on it today and you were trying to reach a unanimous decision. I have had all my vaccines. I had the last one last week. Correlation is not cause. I've had all of my vaccines and I'm healthy. I guess that means that vaccines are healthy. People who have had vaccines and got sick are saying the vaccine causes sickness. Correlation is not cause. And I think there is a lot of misinformation and a lot of misunderstanding of science. People have spoken about Mr. Latterby, the Surgeon General. Most doctors and researchers throughout the nation have condemned and have ridiculed what he has said. It's not a matter of his opinion and FDA's opinion. What he is talking about is not scientifically recognized and should not be. So I commend the board for not approving his position and for not posting it, and I would heartily support your not taking it up again. But just leave it as it is or completely strengthen the position you already have and not Mr. Rowe's position.
Thank you, Ms. Davis. What is your name again?
John Propel.
You can come forward, John.
My name is John Copel. I'm a resident of Sarasota, and I'm in support of Vic's original motion of having Surgeon General Latterby's message up on the website. I'd like to request that we meet every month so that we can communicate the science. One of the doctors that has come here to talk about the safety and efficacy of the protocols has had her hospital privileges threatened. Is this what you do to doctors who follow the science? This is very questionable behavior. From the SMH Code of Conduct, it says, we must never sacrifice ethical and compliant behavior in the pursuit of business objectives. If you were following your own guidelines, would you be implementing protocols that were designed to kill and maim patients? SMH received millions of dollars from the federal government via the PrEP Act. Those protocols included using the fake PCR test, the creator of which, Dr. Kerry Mullis, won a Nobel Prize for this technology, and he said it should never be used as a diagnostic tool. I suppose it was a coincidence that he died prematurely a few months before the pandemic. The hospital to this day continues to use remdesivir on its patients, the same remdesivir whose clinical trial was canceled midstream when 53% of the participants died. They pushed to use ventilators on your patients, knowing that 85 to 90% of patients die after being put on ventilators. How much money did SMH make on implementing these protocols? As far as what you call vaccine, to this day, SMH continues to recommend injecting people with a bioweapon disguised as a vaccine. Dr. Francis Boyle, the scientist and lawyer who wrote the Bioweapons Treaty that was passed unanimously by Congress in 1989, calls the COVID vaccine a bioweapon. And he should know. You know who else says the same? Our Florida Surgeon General. You listen to him or the Mockingbird Media or the corrupt CDC, the Center for Death Control. The CDC redacted all 148 pages of information on myocarditis after the COVID bioweapon was introduced. Wow, that's a surprise. As of today, the Vaccine Adverse Event Reporting System, part of the HHS, federal government organization, said there are 2.6 million adverse events and over 37,000 deaths from these bioweapons. And these reports are dramatically understated. I am proudly anti-vax. Anybody who wants my vaccine, take that, please.
Thank you, John. We've heard every comment, and just a last call for anybody to speak on this agenda item. Okay, with that, we appreciate all of your comments, and I think we need to move forward. We have a motion on the table. We need a second. You make the motion. Sorry, we're gonna go to discussion now. Yes, sorry, and now we'll open up for discussion.
I would like just to address two things that were brought out. Connie Bruni made a strong comment about our reporting to CDC and NIH that I may want to have that line reread so I fully understand what we were saying here. And then the second one, when Michelle Posey was talking about Vic's motion, I think it should be known that the motion failed for a lack of a second. It was not that the motion.
Actually, he amended his motion before he even went to a second, so.
I don't think so. I think this morning, the motion never had a second to begin with, did it?
He amended his motion before the second,
And he amended the motion to do what?
to move forward with this.
Right, but that's like deleting the entire, his entire motion. Is that what you did?
No, actually, I made a motion for a different motion that, and then was superseded by the motion that we have now.
So your original motion never was considered because it never received a second. Is that correct?
It could be correct, depending upon if you heard Roberts as whether or not we're operating under small board rules or for on the regular rules. So that's kind of a technical issue. So the question is, I don't think we've ever determined whether or not we operate under small board rules, which we can because it's a maximum of 12, or if we're operating under the more standard Roberts rules.
And it was never formally addressed that way.
And formally addressed.
Correct.
So are we saying that Vic was the author of the current motion before us? If he made that motion?
I would let Mr. Rowe speak, but my impression was that the motion that is currently before us was a group effort with input, I think from every board member, including Mr. Rowe, with some extensive renovations and work. So unless people disagree, my recollection was that this was a group effort that each board member contributed to.
Okay. I just wanted to make
And also-
sure that the audience understood that.
And to be clear, the motion that is currently in front of the board is the board's motion to adopt the recommendation of the quality committee. So what the quality committee brought forward was a recommendation to the board. And for those who have been around a while, you'll know that that is how this board generally operates. They have discussion in committee and then further discussion at the board level, but the committees do not take binding action. So that's why we're having a conversation.
Is there any other discussion amongst the board members?
I still like the sentence reread related to CDC. I hadn't, I had a motion.
I can do that. I wanted to briefly address, because Brad had asked me a question about this. So I want to make sure that our audience participants are fully aware that this is in fact a governmental entity, that, and I know most of you are, that all of the emails and items that you send to the board members, that those are public records. And hopefully you know that. The offer from the board was to act as a conduit to express concerns from our community to the CDC, the FDA, and the Florida Department of Health about the concerns that are in our community related to vaccines. That really was just to take public records and send them to another governmental agency. Certainly if someone requests that we not do that, we would honor that request. But that does not change the status of the thing that you've already sent to a board member or to all of the board members or to a member of administration as a public record. So that already exists. Your comments already exist on the record and are available for public copy and inspection. I just wanted to make sure folks understood that.
Yeah, and I was just going to say, we operate under the government in the sunshine under Florida. And so anything that's sent to us, anybody has access to. And so anything that is publicly sent to us, everyone in this room has access, and anyone outside the room has access to under freedom of information, freedom of information request in effect. So if you send us something, just know that it's public, and anyone can read it at any time. So that's important that we all understand that. I was just going to say a couple of things, I guess. The doctor-patient relationship is just so important, and I think it's kind of a foundation of how we operate, and how at least I operate, because I really trust my doctor, and what's right for me may not be right for you, or vice versa. And we were, I think, a lot of discussion ensued that when, as a hospital, we're not the final say in a lot of educational issues here, and there's a lot of, as you can see, half the room wants one thing and half the room wants another thing. And for us as a board to take sides, and me personally to take sides, I'm not a doctor. And I encourage everybody to go out and talk to the doctor, Google, do all kinds of research, because every one of us in this room is a little bit different. And if, as a hospital board member, if I'm going to go forward and say, this is right, I'm going to put it on our website, I think that's a dangerous path. And I also think it's a dangerous path in the sense that we're right now addressing COVID, which we took the vaccine mandates down in January of last year.
To be clear, there was never a mandate. There was information, there was educational information on our website about the vaccine, and it came down, I believe, in January of 23.
Thank you, John. Thank you for correcting me on that. But you know, so COVID was last year. I realize it's important to me. Right now we have 5 COVID patients in Memorial and none in Venice, I understand. But again, if you have cancer, that's really important to you. Right? If we're going to address COVID, do we address cancer? Do we address strokes? Where do we draw that line? And I think there's just so much information, and all of you have done your homework, and I think that's great. And I appreciate your comments. I think at every one of these board meetings, we all learned something, and hopefully respectfully from each other. But I just don't want the hospital, I want the hospital to be my doctor telling me what's right for me and what I should do. And that's just how I approach this. Thank you.
Anybody else?
Madam Chair, I just want to, one of the things that the committee did not discuss was Connie Rooney's point, that members of the public can feel threatened by that provision. So I'm going to move that we strike the last sentence, whereas it pertains to forwarding those complaints to the FDA and CDC and the state. I'll make that motion.
I think, are you asking if the maker of the motion would amend the motion to remove that? I think that's what you're asking.
Yes.
To remove the final point that we would forward the concerns of the community to the FDA, the CDC, and the Department of Health. I think it's point 5.
I would support striking that.
Patty, it's your motion. Technically, are you in support of removing that provision?
He can move it, we'll second it, we'll just do it as an amendment.
I think it's a friendly amendment at this point, so.
You made a second of it?
Yeah, okay. Unless the secretary, I think you're the secretary, you're not
Sure.
going to that.
Then officially we should probably vote on that and then go after motion.
Well, a discussion then on that. Can we get clarity on why you want to remove that? Is it just because of Michelle Posey's comment, or are we just
No, it wasn't
removing anything else?
It wasn't Michelle's Posey's comments. It was, no, Connie Rooney's.
Okay, sorry,
That
Michelle.
she feel threatened, and we never discussed, when we discussed that motion, we never discussed the fact that people may feel threatened by that. And it didn't occur to me, it didn't occur to anyone else here, but now that now it's been made, and it's been further explained that, look, it's all public record anyway, there's no real purpose for us to do that, and plus, there's some cost to forwarding all of those to the FDA, so we save money.
I'll call the question on the amendments.
All in favor
Of the amendment.
of the amendment, of Vic's amendment to the item 5 on the proposed motion?
Yes.
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 He's speaking to the mic. The mic, he can't hear you.
No. 8-1 passes. Yes. Okay, so we're back to voting on the motion without that line. Is there any more discussion on that?
I would still like to have the motion read before we vote.
For the, without that?
Without number 5 is
Okay,
very
you would
short.
only ask for that line to be read, I just want to clarify.
No. Sorry.
That was a good.
The current motion in front of the board, as amended, is that the board will continue to respect and honor every patient's right to make their own healthcare decision within the patient-physician relationship, and using all resources available to them to inform the discussions surrounding those decisions. That the board will continue to endeavor not to invade the physician-patient relationship or mandate treatment regimens for patients to its physicians. That the board will respect that patients, in conjunction with their care providers, should decide which recommended treatments or interventions they use, including what vaccinations are right for them. And that the board will continue to advocate for retrospective analysis, research, and evidence-based recommendations from state and federal regulatory agencies with the responsibility for public health initiatives, including vaccines, and encourages patients and their healthcare providers to access all credible resources regarding their discussions and decisions.
Any further discussion?
Well, I wanted to speak to some of this, at least with, a lot of, constituents that worked in public health, that pushing this without the transparency or a lack of education, or being informed from both sides, has caused a lot of vaccine hesitancy. Right now, like I stated before, we have less than 5% as of October 31st for COVID and flu vaccination because of things that have transpired. Canada has also followed suit. They are less than 15% for boosters for COVID. And one of the studies that actually has already come out, which I know they said they're following the science, but we've actually caused tolerance. So most of the people that have had multiple boosters have actually caused tolerance when they're getting COVID more frequently because of IgG4. That's actually a publication in PubMed. And saving one life, for every one child that we saved with the COVID vaccine, we killed 30 more. They died, myocarditis, MIs. I mean, this is mutated. I have physicians, they will not speak up. They do stem cell research. Stem cells will no longer be taken for anybody that's had the COVID vaccine because the DNA is mutated. But I don't feel it's our place as a hospital to post because we're bullying the same way the mandates were. If we're telling people that we need to remove this vaccine, I say let them take it.
Anything else? Thank you, President. How do you welcome to speak?
I'm just not sure what, we're taking that last sentence or paragraph out. Where are we now? What have we accomplished with discussion? And then that resolution will be amended. Where are we now?
So everything other than that last line of forwarding on to the FDA and CDC will be our motion.
Okay. Is that something that people are satisfied with though? Because they're concerned, we thought we were doing a good thing. I mean, that's how I interpreted it, that we would pass on. And Connie, in no instance was I thinking that putting you in jeopardy. I mean,
So one thing that we could do, and I'll bring this back next time because it's really outside of the scope right now, we could aggregate the information and send, if we have folks who come and speak, and we can take the notes from today and take the names and any identifying information and say, these were the comments that were made at a recent Sarasota County Public Hospital District meeting with regard to the vaccines. These are the concerns of our community, please address. And that we won't attribute them to a person, we won't forward emails, but we can aggregate the information. And I'm not asking you guys to vote on this or add it back in the motion because it's outside the scope now, but that is something I need to address your concern and you guys can talk about it.
I don't think we need to do that. I think what we have before us is a resolution that the board is supporting the patient-doctor relationship and that we as a board will not have our hospital interfere in their relationship. I think it's a clean statement. And to drop number 5, to me, was no big deal.
With all due respect, I disagree. I think that Patty's point is of the 11 speakers, their concern is that they're not being heard by the FDA and the CDC. And so, as Connie said, she doesn't want her name on that, but I think the idea is to stress that there are concerned community members and that we're recognizing that as well.
Yeah. If they had problems with the FDA or NIH or whomever, they address that their federal elected officials. That is not our role.
Until they go back. Up until they go to Beck and say, we need this motion. That's what's gonna happen again.
I think we pretty well hashed this thing among ourselves. I don't think the city is going to bring a different.
We did not.
So this is a little bit outside the scope, yeah. Maybe we can discuss it next time, if a board member brings it up next time. I'll prepare something, and if a board member brings it up, then we can have a further discussion about whether or not there's anything that needs separate and apart from this motion, which I agree with you, stands on its own.
It stands on its own.
The fifth provision was not integral to the position of the board.
I have a question before you call the question.
I can't
I
understand.
request that you call the question.
Thank you, yes. Call the question, we call the question. So, all in favor of the motion as it stands, say aye. Any opposed? No, no.
It's the four pieces without the fifth piece, the amended motion.
Bridget? No? All right, Bridget, are you a no or yes?
Yes, I feel that it's a huge part because they don't feel heard, but unfortunately, this isn't the way to go about it, is through us or the hospital, like Lee Memorial doesn't have anything like that, we're a public hospital, and trying to change it through us, but it's definitely the wrong way to go.
Richard, you brought up a really good point, and that's that, from what we can tell, no other hospital. Awesome.
Sorry. Okay, so I'm gonna call it one more time. All in favor, say aye.
Aye.
Any opposed? Say no. Thank you. Motion passes. Okay, we are going to move forward, and with that, we have David Verinder, our President and CEO, to give his report.
Thank you, Madam Chair. Let's start. Seems to be going enough. Okay, I'm going to go ahead and start looking at our organizational report card year to date through April. We start with the 5 areas of concentration, the first being in service. We have a goal of having 8 out of 10 of our areas having a likelihood of recommending greater than or equal to 75th percentile. Happy to report that we are exceeding that goal of 9 out of 10, and I'll show the details of that here in a minute. In the area of people, we have our goal of having our new hire retention, a percentage 83% or higher of our regular and full-time employees that are hired in FY 2024 still being employed at the end of the year. We are tracking higher than that to 91%. In the area of quality, our goal is to have our combined overall standardized infection rate be less than 0.8. Happy to report we are doing better than that as well, 0.52. In the area of finance, we have our goal of having our operating margin be at 5% or higher. As Bobby reported earlier, we are trending at 5.4%. And then finally, in the area of growth, we have 2 goals. The first being our inpatient admissions and observation outpatients being at 75,456 or higher. We are trending higher than that. That's 80,614. And our outpatient registrations at 1.18 million, and we are trending higher than that as well in 2022. Looking in further detail on our patient experience report card, our you start over to come on the left-hand side with the 10 areas that we surveyed, likelihood of recommending. The middle column is our score. Next is the national median score, and then finally, far to the right is the 75th percentile score. I'm happy to report that we are hitting, as I said a second ago, 9 out of 10 of those in the 75th, 10 out of 10 in the national median. The one being 1 point off is radiation oncology. As we reported earlier, we reported in the media earlier this month, Sarasota, SMH Sarasota continues to receive straight A's. Safety Street and our SMH Venice are an A on its first ever safety report card from Leapfrog. Leapfrog just released its 2024 hospital safety report cards, and both SMH campuses received top marks. Congratulations. SMH recognizes top healthcare workplace. Sarasota Memorial is proud to announce its inclusion in Becker's Healthcare 2024 list of 100 top places to work in healthcare. SMH is the only healthcare system on the Sun Coast and one of only 7 in Florida to be named to the list. The honor recognizes SMH's commitment to fostering a workplace that prioritizes employees' professional and personal development and well-being and provides opportunities to give back to the community. The list highlights providers that positively influence their employees and communities. The new tower, a new tower opens at SMH Venice, easing capacity constraints. SMH Venice is on track to nearly double its inpatient capacity from 110 to 212 beds this year. 68 new private patient suites opened this last month, and 34 more private suites are scheduled to open in the fall. Construction will also be complete on this fall on a 30,000 square foot expansion of the hospital's emergency care center. These projects are in response to the high demand for care in the community. Since opening in 2021, SMH Venice has operated at or near full capacity and has a critical safety net for people following the closure of Short Point Venice Hospital in Hurricane Ian in 2022. SMH celebrates our outstanding nurses. Sarasota Memorial joined the nation celebrated Nurses Week May 6th to the 12th, recognizing the exceptional care, commitment, and compassion of our 3,500 nurses and our 1,100 PCPs and MSPs who support nursing care system-wide. Our nursing team has long been recognized among the best in the nation. Last year, SMH Sarasota earned Magnet designation, the highest honor for nursing excellence for the 5th time and for 20 years running. That's a feat that's only been accomplished by fewer than 1% of the hospitals nationwide. The SMH Foundation raised record amounts to support cancer care. The Sarasota Memorial Healthcare Foundation recently celebrated completion of its Leading with Care Cancer campaign, which raised over $93 billion to support the Brian D. Jellison Cancer Institute. As SMH's philanthropic arm, the Healthcare Foundation launched its cancer fundraising campaign in 2017 with a goal to raise $50 million in 5 years. In 2020, a $25 million gift was made by the Brian and Sheila Jellison Family Foundation. Beyond advanced care treatments and state-of-the-art facilities, the transformational gift helped create a centralized place to assist patients and families facing the many complex decisions that accompany cancer diagnosis. The Jellison Cancer Institute includes our radiation oncology center, inpatient surgical oncology tower, and a new William Covert Cancer Pavilion slated to open in 2025. SMH honors staff's dedication. Sarasota Memorial honored more than 750 employees at our annual service anniversary celebration, recognizing staff who reached milestone work anniversaries ranging from 5 years to an incredible 45 years. With more than 10,000 employees, SMH Sarasota Memorial is Sarasota County's largest employer and has been repeatedly enlisted as the best workplaces in the nation, including Forbes, Becker's, Newsweek, and Cal. We also have a chance to celebrate our incredible volunteers. National Volunteer Week was April 21st to the 27th, a time to recognize the selfless service of our 700 volunteers. They've helped us launch many important programs and services over the years. SMH wouldn't be the nationally recognized organization it is today without it. Our volunteers truly make Sarasota Memorial a better place for patients and staff. Madam Chair, that is my report. I'm happy to answer any questions.
Thank you so much. Does anybody have any questions for David? Okay. With that, next on our agenda is the consent agenda, and we have nothing on that. So we will move on to public comments. We have just a few more that were not on those agenda items. I will read your name, and then the next speaker will be on that. So first up is Marcia Nugino. Marcia? Okay. Behind that is Mariella Schuler.
Skylar.
Sorry.
And, I passed on speaking, but I have to congratulate you without confusing the entire audience, including yourself.
I'm sorry, Marcella. Well, if you would like to speak, we would be happy to hear from you now. Next is Richard Carnell. Mr. Carnell? Carnero? Okay. Carnero? And last up, Jamie Burns.
Good afternoon. My name is Jeannie Burns and I live in Kentucky West. I'm here.
If you please speak into the mic.
I wrote a letter to the board, April 5th, regarding, the processes and procedures at SMH for, do not resuscitate orders, DNRs. So I'm going to read it now, and I've given a packet for each board member.
So I'm deeply sorry to do this. If the packet is the one that you presented when you came in, the board is gonna have to decline to hear your comments. It contains protected health information that you do not have the authorization to disclose in a public setting. And while the board welcomes your input, and as I believe you've been told, has extensively investigated your claims.
No, I've heard nothing.
I'm sorry, I thought you had received a letter from our risk manager, but go resend that. But we can't let you breach the confidentiality of the patient in question without the permission of their healthcare decision maker, and we do not have that. I'm so sorry.
I see.
We'll follow up with you. I'm sorry you didn't receive that letter, but we will follow up with you again.
Is there anything else?
Well, I guess I just have to express some disappointment that my brother died in this hospital. And I believe that the person who's in charge of his health information caused that to happen. So SMH may have legally assisted premeditated murder. That's the point. That's why I'm here.
Thank you.
Okay, thank you. Yes, thank you so much. With that, is there any other business? Our meeting is adjourned.